everyone, welcome to my vlog, Puah-Midwife services. How you all doing? Yes, it's been a while since I last vlogged about anything. I've got 3 kids and I work full-time, so sometimes life happens and you know, we don't get to vlog as much as I would like. But anyway, on today's topic we're going to be discussing cesarean section versus normal vaginal delivery. Actually, I had both. For my first child, I had a normal vaginal delivery, and for my second, which were the twins, I done a previous video on how I conceived my twins 2 weeks apart. I actually had to have a cesarean section earlier on at 34 weeks because they were quite worried that the twins were their growths were quite restricted, so they were quite small. So when they were born, my daughter weighed 2 kilograms and my son weighed 1.5 kilograms at 34 weeks, which is quite small, less than the average actually. So yeah, that was why. So, and then I get to see a lot of women who are still weighing their options between having a cesarean section versus having a normal vaginal delivery. So I've looked after a lot of women in the past, either who had had a cesarean section or who had a normal vaginal delivery. So I hope I'm going to be able to tell you what the differences are. Actually, 1 in 4 women would end up having a cesarean section. Lancet did a study a while ago comparing the rates of cesarean sections back in 2000 versus 2015, and in the year 2000 the rate was about 19% compared to 2015, where it spiked up to 25%, and currently it's at 26% in the UK. So you'll have 26% of women who have cesarean section, which is quite high. It's quite a high rate. And cesarean rates are 10 times more frequent in Latin America and in the Caribbean, where you have their rates at 44% compared to the West African countries, who are actually at 4%. And that's quite a huge disparity between the poor and the richer nations. And we wonder why. This could be due to cultural beliefs and societal norms. Like, take for example, now in West Africa, the women tend to be looked down upon if you have a cesarean section. So women don't like to talk about it because they're like, oh, she had a cesarean section, she didn't push the baby out. So, and you know, it's the cultural thing whereby you're seen to be a woman if you've pushed your baby out. But I think things have to change, because most women have cesarean sections not through any fault of theirs, but it's as a matter of life and death. You know, the baby has to be born that way. And you have to look at it at the other angle, where cesarean sections actually cost more compared to having a normal vaginal delivery. So those are the two things. And then in the Western society, you're on the other angle, where women want to have cesarean sections because they don't want anything to affect their sexual lifestyle. So, you know, when some women, not generalizing, but some women don't want to, they're petrified about the after effect. Is it all going to be the same? So you have those 2 huge gaps in beliefs and norms. So yeah, cesarean section is actually a surgical procedure, which is either done under general anesthetic or a spinal, and it's an incision on the just above the bikini line. If you're lucky to have a wonderful surgeon, you don't really get to see that scar because it sits nicely on the bikini line, and the wall of the abdomen gets cut. Another incision is also done on the wall of the uterus, so that's where the baby is delivered out from. There are different reasons where, 2 different reasons where you'll be offered a cesarean section. So elective, you could be offered an elective cesarean section if you're having multiples, and depending on what the positions are, they're breech or transverse, depending on the lie of the babies, you could be offered a cesarean section as an elective. And on the other hand, as an emergency, when it's a matter of life or death, they have to either save the mother or baby, you'll be offered an emergency cesarean section. Some of the reasons could include for medical reasons. So let's say the woman is suffering from eclampsia, which is to do with raised severe high blood pressure in pregnancy, or diabetes. The woman could have infections such as HIV, AIDS, genital herpes. It could be to do with problems with the placenta. So for example, you could have like placenta previa, which is when the placenta covers the Beck canal, so you can't really have a normal delivery from that. Placenta accreta, which is when the placenta is merged too deep into the wall of the uterus, or abruption, which could be partial abruption or complete abruption, which is when the placenta separates from the wall of the uterus. So this could be reasons why you get offered an elective cesarean section. Also, fetal macrosomia. Let's bear in mind that some women from the African background, we always say that they have a wider pelvis so they can push a big baby out. We look at the history of the mother, the history of the father, you know, her BMI, her build, you know, we take that all into consideration, previous experiences, previous deliveries, how much is the baby weighed in the part, how has your previous kids weighed. So if it comes to large babies, all that is taken into consideration before the doctor offers a cesarean section. A failed ECV, which is when the baby has been in a breech position and the doctors have tried to turn the baby the right way around and this has failed, you might be offered a cesarean section. Some of the pros or some of the advantages of having a cesarean section could be that it's controlled, so you know when the baby's arriving, you know that this is the date my baby's going to be born, so for that time short while you're in control of what, not that you're in control, but at least you know what's happening, and you know the time, not exact time, but at least you have an estimate idea of when the baby's going to be born. So that could be an advantage. Obviously there's going to be less pain initially, so it could be an advantage to the woman that at least for the time being she's in control of what's happening and she's in less pain initially. But there are also some quite a lot of disadvantages that I found. Hello, I had both, so you know. Blood clots. You're actually at more risk of having blood clots in a cesarean section compared to a normal delivery. At the end of the day, it's a surgical procedure. You're actually at more risk of developing infection from the wound side, from the incision side, bearing in mind that the wound has to heal from the inside as well as outside. More risk of infection, oozing, complications from the anesthesia. So there's a greater risk of complications from anesthesia. Remember, it could either be general anesthesia or spinal. So there's a greater risk involved. And we also say that having a cesarean section could also lead to you having more cesarean sections in future. And obviously which could lead to uterine rupture and all that. It's a longer recovery time, definitely, compared to a normal vaginal delivery. We say that cesarean sections, your healing time could be between 6 to 8 weeks or sometimes even longer. So it's a longer recovery time. There's the pain and discomfort because sometimes the stitches pull from inside. You know, you're unable to get back to your normal daily activities. For example, driving. You're not allowed to drive till at least about 6 weeks. And I found this bit the most frustrating bit because when I had my cesarean section, I had my twins in hospital for about 10 days. So like day 2, day 3, you're discharged home. I remember breaking down at day 2 when I was sent home, being a midwife. Hey, you know, you find yourself in kind of certain situations that it's under your control. And I remember thinking, how on earth am I supposed to make this trip to the hospital every day to see my twins, bearing in mind that I've just had a cesarean section. So I broke down and I was allowed to stay for 1 extra day. But that was the most difficult thing, trying to get out, get going, you know, but you couldn't because you were restricted, your movements were restricted. And I found that very hard. And the pain was so unbearable with my cesarean section compared to a vaginal delivery. And one of the tips I have for people who either booked to have a section or who have had a section is, with the pain, you have to get yourself like a little cushion or a little blanket. If you're about to stand up, make sure that you have the pillow or the cushion just above the incision, just where the incision is. It's going to help you get up, sit down, especially coughing and laughing. Just have the pillow there because it actually helps with the pain. Also, laxatives are going to be your best friend, because can you imagine being constipated and trying to do a number 2 and you have the stitches still healing? That's the most painful thing ever. So yeah, so doing that kind of helps. Now let's look at a normal vaginal delivery. You know, straight away the bonding I mean, you're going through, you're in labor, established labor, you're having regular contractions, therefore that's going to help with the dilatation of the cervix. So, you know, we're getting somewhere. Yes, it could be longer compared to a cesarean section, which is just then on, within 45 minutes is over, compared to a laboring patient who we really don't know, especially for first time moms, it could be a longer process. But still, once the baby is born, straight away you're bonding with your baby. The baby's placed on the mother for skin to skin. You know, breastfeeding could be initiated straight away. So there's no time compared to the cesarean section. Yes, you get to see the baby, but you don't really get to spend a longer period with the baby because immediately the baby's taken to the resuscitator to be seen by the pediatrician. We might have to transfer the baby out to the NICU. You know, so there's that restriction, time restriction with the cesarean section. During the normal delivery, as the baby is coming through the birth canal, the muscles help to squeeze out excess fluids from the baby. Therefore, there's a less likely chance of the baby suffering from breathing problems, suffering from asthma. Compared to the cesarean section, you have more babies that suffer from asthma at a younger, when they're older, due to the cesarean section. And also the baby gets a helpful dose of good bacteria coming from the birth canal, so this helps to boost the immune system. And you know, you're up and about after a normal vaginal delivery. Yes, I know there's a likelihood that you're going to have a tear, so depending on the grade of the tear, the level of the tear, was it a 1st degree tear, a 2nd degree tear, a 3rd degree tear even. So when I compare a 3rd degree tear, okay, let's say worst case scenario, you had a 3rd degree tear compared to a cesarean section, you find that yes, for the first couple of weeks, yes, you could be suffering, it could be excruciating pain, but still you're able to get up and about compared to having a cesarean section. You're a lot more restricted. So I think being well informed, knowing the risk, the pros and cons of both, and making that decision for yourself based on the information that you have at hand is key. And I think that society has to change now in trying to discriminate against women who've had a cesarean section to deliver their babies. No, there's nothing. At the end of the day, it's the safety of what mother and baby. And I have some women who have been through IVF, and this is a precious baby on board. They don't want to take the chances of anything happening during labor and have opted to have a cesarean section. Why would I look down on that woman because of her decision? No, I think we need to change our way of thinking, that our job as midwives, our job as healthcare professionals is to offer the best advice to all women. Give them the information at hand, like I've just done, telling them the pros and consequences of having both, and let the woman decide for herself what's best. You know, and yes, and it's our job to state out, you know, if being asked, what would you do? You know, like I said, sometimes it's beyond, it's out of our hands how it goes, but if given the option, it's important to choose wisely. I hope I've been able to explain the pros and cons of either having a cesarean section or a normal vaginal delivery. And yes, so looking forward to having you guys tune in to my next vlog. Please like and subscribe to my channel, Puah-Midwife, and I'll be more than happy to answer any questions or concerns that you have. Until next time, thank you. Bye.